My daughter is 16 and has Asperger syndrome. Most colleges want kids to have a foreign language in high school. Is it harder for an AS kid compared to NT kids to learn to use a foreign language out of context? This is Lassie at Autism Hangout.
Well, first of all, those with autism and Asperger's already speak a second language. It's the social language.
Yeah.
So they're already bilingual or bicultural, because neurotypical and Aspie cultures. Now, what I tend to find is that those with Asperger's with language, if they're good, the language that they're learning exactly as they hear it without having the accent of their home country. And so they will speak it, and others will say, wow, you're Russian, where do you live in Russia? And that's from a Russian person. Or they're absolutely hopeless at it. And if they're hopeless at it, cut it out and don't do it. Mm-hmm. So if they're good at it, they will be superb and they'll be multilingual. And I have met in my travels at international conferences, sometimes when my presentation is translated into foreign language by a multilingual person, at the end of the presentation I'll say, Tony, you've just described my life. That's who I am. So that's one of the career options. But for others, they have no idea, and it causes more problem than it's worth. If she's not good at it, doesn't like it, if in doubt, cut it out.
Let it go. Dr. Tony, in the social group that I run, I hear a lot of parents' concerns that their young adults may be taken advantage of for money and possessions. How can a person on the spectrum guard against people who may want to take advantage of them? And are there strategies that parents can employ to help decrease their young adults' vulnerability? This is InkSpot at Autism Hangout.
Okay, this is where neurotypicals have a built-in radar to spot bad characters. For those with Asperger's, they tend to focus on what people say and assume that other people are as honest and have the same degree of integrity as they have. Neurotypicals say it's naive. I think that's actually a quality that with Asperger's have. And it's very difficult to actually teach a person with Asperger's this person is disreputable. So all I can suggest is that you help the person find someone who is very good at character assessment. And they're the ones that give the green light or the red light as to whether to pursue this further. So they need to meet that person. So it may be that if it's a business meeting about signing away your mortgage for your house, etc., then they need someone who is experienced in this area. If it's someone who is, in terms of taking advantage of that person, not in finances, but sexually, they need someone else again to meet them for coffee and say, is this person okay when they've gone? They have clear advice not to go any further.
Mm-hmm. The last question is also from InkSpot. It seems that there's very little research dealing with depression in Aspies. Most of the techniques used to help are based on NT chemistry. I've often wondered if this makes a difference, since a lot of these techniques are ineffective in Aspies. In my experience, external factors act as a trigger, but internal factors amplify and worsen the condition. Things like anxiety and overthinking also seem to make things much worse. Do you have any suggestions on dealing with depression in Aspies, and is there anything family or friends can do to help?
Very poignant and very important. At the moment, I've been designing with my colleague and friend Michelle Garnett a CBT program to treat depression in teenagers with Asperger syndrome. We found it highly successful, but the University of Queensland is now doing a randomized controlled trial with teenagers to see if it works. And next year, Michelle and I will be working on a program for adults with Asperger's with depression. Now, the question relates to brain chemistry. I don't think it's necessarily brain chemistry that is different, but experiences and thinking. That is, that the person with Asperger's has had much more bullying and teasing, and one of the tragedies is they've believed and internalized the derogatory comments of their peers. I am stupid, that I am a loser, etc. And so whenever they make a mistake, well, that proves I'm stupid. Mm-hmm. And so their thinking is very much a negative one that I'm afraid is often caused by their peer group. Mm. Now, when you ask a person with Asperger's, what are you feeling now, or what were you feeling at a particular time, they'll often reply, I don't know. And that's a short form for, I don't know what thoughts are going through my mind at the moment. I can't grasp them and conceptualize them, but they're negative. And I can't find the words to nicely describe them in a way that you will understand. But that's such a complex sentence. They say, I don't. So in other words, it's trying to grasp and describe internal feelings is very difficult, which means often the person tries to solve life's negative events themselves without sharing it or using affection and compassion as a way of alleviating feeling sad. And there's also the issue of anxiety, is worried about what might happen. Depression is, you know what's going to happen, is going to be bad. So there's the two will produce that. And overthinking is not being able to stop the thought until you have closure and know why. And so it just goes on and on. So when we look at this, there are major problems of depression and cognitive behavior therapy, and also reasons why it stays longer in such a group and can be a terrible depression of talents for that individual. So what I would suggest is that if they could wait until next year, we hope that the CBT program for teenagers will be available, and also the one for depression. But otherwise, I think that's a very important topic to close on.